My name is Dave McDermott. I think I've met most of you or talked to you on the phone maybe in COVID world, but thank you for taking the time to join our 2022 action plan public hearing. Or we have two things to go through. One is the 2022 action plan and one is a substantial amendment to the 2021 plan. So this is familiar to all three of you, I believe, but so the consolidated plan every 5 years, we kind of work in 5-year chunks. Consolidated plan identifies the community needs and sets the priorities for that 5-year period. And then each individual year within that 5-year plan, that's the action plan and that's what sets the actual projects that we're going to accomplish in the next year. So today we're discussing the action plan projects for 2022, which runs from April 1, 2022 until March 31, 2023. This is year 3 of 5 in our cycle. We do not have our official federal amounts yet. They haven't passed a federal budget yet to give us our exact amounts yet. So we make the plan based on previous year amounts, and then we adjust from there. So let me go through those amounts for you really fast. So in terms of our annual allocation, it's typically around 3.9 million in CDBG funds, community development block grant funds, typically about $1.8 million in home funds, affordable housing funds. Hi, Joe. No problem. We just got started, but glad you're able to join us.
Yes, thank you. Sorry about that. I was trying to get on and it wouldn't let me on.
Oh, all right. Well, hopefully no one else is having issues. Sorry, I'm just taking a quick list of the attendees. So, Joe, thank you for joining us. I don't know, have you participated in one of these before?
No.
Okay, so each year we are allocated money from HUD to perform community development work in DuPage County. We get roughly $3.9 million in what's called community development block grant funds, $1.8 million in home funds, which are typically affordable housing or related to affordable housing, and then approximately $300,000 in ESG funds, emergency solutions grant funds. Those fund homeless services. As part of our plan each year, we're required to hold a public hearing like this to get input or questions from the community about the proposed projects that we're presenting. So I was just jumping into that now, and then we'll kind of go over what the plan is. But that's the kind of overarching concept of it. I was talking about the official amounts will come when the federal budget is passed, then we'll have our official amounts for the year. But those are typically our amounts are in that ballpark.
Okay, thank you.
Sure. Okay, so the other thing I was going to mention is that we, in addition to our annual allocations of funding, we also have funding left over from previous years that we can program into our action plan. We anticipate some program income. So program income is if we made a loan into a project and that loan got paid back, we count that as program income as opposed to grant funds. Or if we had a project that for whatever reason changed their use and that money came back to us, then we can program in that. So sometimes we actually do more than $3.9 million, for example, in projects in a given year. Most years we do more than that because of previous resources or because of program income. So for 2022, we're anticipating around $50,000 in program income for CDBG, and we're using about $450,000 in that previous year resources. And then for home, which is the affordable housing grant, we're anticipating about $164,000 in program income. And then we're using about $1.5 million in prior year resources. Okay. In terms of goals for this action plan year, so we do projects in a number of different areas. Municipal infrastructure is one. Public services is another, so that can be, for us, it mostly focuses on services for homeless populations or agencies that are serving homeless populations. We do nonprofit capital work that'll be familiar to several of you in the area. We do projects for nonprofits in there, capital improvements to their facilities. We do affordable housing work. We do homeless services, and then we do still have referenced in our action plan is about $2.6 million left in disaster recovery funds that go back to an April 2013 flood event. So that still is listed in our action plan. We are just getting underway with the very last projects on that. So we're hoping to get that done soon. In terms of specific projects for 2022, we have 600,000 set for street improvements. That is specifically going to be in the city of Warrenville. We have $1.8 million set for water and sewer improvements, and that's in the villages of, so that's in Villa Park, West Chicago, and Glendale Heights. We will be doing some nonprofit capital improvements this year. So both Serenity House and Hope Fair Housing are included in the plan for 2022. We also have one park and recreation project. So Carroll Stream Park District is on the list for funding in 2022. Beyond that, we have for affordable housing, for our large affordable housing grant that I referenced, there is a senior housing development in Addison that was included in our action plan for 2022. That is a project to produce 61 units of affordable housing. It'll be new construction, 61 units of affordable housing for seniors in Addison. And we'll also continue to do tenant-based rent assistance, which is another part of our home portfolio. And then we also do, we work with CHAD, our local community housing and development organization, to have projects for them. So again, affordable housing related. And then with ESG, ESG is very specific. It's a very specific grant in terms of what we can do and what we can't do. So we fund emergency shelter, we fund rapid rehousing, we fund homelessness prevention, we fund HMIS, which is our homeless management information system database. And then we, in each of these funds, we also can fund some money for admin. So to cover our own costs for our own staff and our own operations. The other thing I was going to note, so I think in terms of big changes for 2022 relative to previous years or relative to what we've been doing in the past. So we're obviously making, or we sent out information to at least a couple of you, but we're making some changes with our public service. So we are resetting the public service program in 2022. So we still funded 2 projects, but we are looking to reset that in 2022. We're going out for new applications in August, September, and then 2023, we would have public service should look very different. The other thing I wanted to mention is that all of our projects are selected through a competitive application process. So what we're doing in this 2022 action plan is actually braiding together 2 separate application processes that took place. So we did one in the fall of 2019 for both nonprofit capital projects and for municipal infrastructure. And then we did one just this past year for municipal infrastructure. So we took all of those applications together. Anyone who was initially awarded money or expected money in the first application round is still included in the either, if not this year, in the next 2 years. We still have them on the list for projects to be funded. Anyone that then was selected through this most recent application round is slotted into, successful applications were slotted into one of the next 3 years. So I'm going to pause for a minute. That's a lot of information. I guess I just want to stop, see if I have questions. This is probably, Joe, there's a lot of sort of HUD speak here, or, like government speak here. So if there's, I want to stop and just make sure kind of people understand how the funding works, how we set our priorities, and then how we select projects.
I have actually I've not participated in one of these, but I'm very, very, very familiar with the government, all the types of meetings and that, so.
Okay.
Thank you.
Yeah, no, very good. Are there any specific questions about the projects that we're having slotted in 2022, or about the selection process, or about the 2022 plan? Yeah, go ahead, Tim.
Hey, David. Is there any consideration that those projects on your plan that are scheduled for the next following year, the year 4 or 5, might be reslotted into 2022 should there be funding available for that purpose?
Sure. So it's possible, right? So we don't know exactly what HUD is going to give us in terms of our funds, or we may have a project that falls through for whatever reason, and then we look to move a project up. So it's possible. It depends a little bit on factors that are either outside of us, so either a federal government factor, or if it, like I said, if there's a project that just for whatever reason doesn't work and we have the opportunity to swap one out, we can do that. There's an amendment process where we can change our plan for 2022. I know, I think you're on the list for, yeah, either 2023 or 2024, I know. So I guess, and the key thing we always tell people is don't start before, right? So make sure you don't exclude, if you're on the list to get funding in a future year, make sure you don't do anything that jeopardizes that funding by starting the project beforehand. We're always reaching out to people about both project readiness and then just making sure we can still confirm eligibility so we could fund it in a future year. But it's possible. We have projects that move up every year, or we have projects that change every year. They either move up or move back or those kind of things. So.
Well, we appreciate that the department, the CDC, has looked at what the likely costs are going to be projected into the future, especially in the housing market, and have adjusted the amount allocable, or at least recommended accordingly. So thank you.
Sure. Any other questions on that? On 2022, I guess, or on the proposed activities in 2022? I'm sorry, we had one person that joined and then I think dropped out too. I didn't catch his name. Okay, we have one more agenda item to go through, and then I will give you one more last chance to ask any questions or provide any public input that you would like included in the plan. Any input that you provide gets written into our actual plan and submitted to HUD. So if anyone does have a public comment they want to make, we transcribe that and enter that right into our plan. But the second agenda item for today is we also have to discuss a substantial amendment to our 2021 plan. So this is kind of to Jim's point. So periodically we identify additional funds that are available. In this case, we found some prior year resources that could be allocated to an additional project. And so we've allocated that to a project at the DuPage County Care Center, which is right here on our campus. It's a nursing and rehabilitation center that primarily serves low and moderate income populations, which is the target population for these funds. So we had, for example, we had a project that fell through that was supposed to be a 2021 project. They canceled, so we were able to use that funds. That was in the amount of $173,000. And then we found some additional funds, or identified some additional funds from previous years that hadn't been in any project. And so we decided to move those funds into this project. And to do that, it's required to have one of these public hearings. It's required to have 30-day comment period. And so, the advantage of doing that was really we have a set aside for the care center every year. So the care center kind of gets one grant a year because they have a number of needs in that facility. They're skipping their 2022 year in a way, and they're getting their money in a 2021. So it's just it's a timing thing on our end to try to make the grant work a little faster. But it's not like they were getting an extra grant per se. They're just getting kind of moved up. But that kind of does get to your point, Jim, of we can sometimes move things around depending on what funds become available and what what opportunities present. So, but that is the only item that's a significant change for that plan. So again, that's the substantial amendment to 2021. We have moved some funds around to fund one more additional project in that year. Any questions on that? All right, I will open it up again one more time for questions, comments, concerns, anything you would like included in the record or included in the action plan. This is your opportunity. We do really appreciate all, appreciate you participating in this. We appreciate any input you guys can provide. It's good. I've had public hearings where I didn't have anyone show up. So I mean, at least this time we had 4 people who don't work for us. So that's good. No, I mean, it's an important part of our process to make sure that we're getting input from a variety of community voices. So
those are very frustrating, setting up public meetings and nobody shows. And you sit there for 15 minutes and you wait it out.
Yes. So we are, happy that you guys were all able to join us today. In terms of like what the future will look like, and I'm thinking of, especially the nonprofit partners here, but anyone, we'll have some discussions at the board level about public service priorities in the next couple months. That's something that kind of keep on your radar. And then the next consolidated plan process, the next 5-year cycle will again kind of look at the community needs and how those have changed and what the priorities are. So good things to have on your radar over the next couple of years. Okay, if there are no, does anyone want to make formal public comment? Does anyone have anything they want to include? You don't have to, but if you want to make a formal public comment, you can. Okay. Ms. Hamlin, anything I missed? Anything else I need to include or do?
No, but thank you all for your time. We appreciate it. And we do value your comments, your feedback, your participation. All of our plans are, of course, geared around serving DuPage County. So the more information we have, the better we can make our plans. So thank you all very much for your time.
Thank you.
Thank you.
Okay, with that, we will adjourn. Have a very good evening, everyone. And yeah, we'll see you hopefully in person at some point in the future.
Thanks. You all
Thank
take
you.
care.
You too.
Bye.
Bye.